O- Okay. Hey, everybody out there. Hey, Parham, how are you?
What's up, Dr. B? Happy Sunday. Looking forward to being here. We have some people already ready to go. The chat is going. What's up, everyone?
Hey, everyone.
Thank you for being here. We look forward to spending some time with you today.
Yeah, we do. And TikTok's on. How's everyone doing? I hope great. And this is a pretty cool topic. Before we get started, let me make a full disclosure. Uh, I know nothing about sports, and I've never followed a single sport in my entire life. Hey, TikTok guys, I see you guys coming on. If you have questions, we'd love you to get on the YouTube channel, ask your questions, and I'm on there live with Parham Namatola. It's pretty easy to get on, and I won't be answering questions on here. It's just too much for me to do. So go on the YouTube channel. I have this thing running for those of you that just want to listen. But here we are, and we'll get going. So, Parham, this guy, you gotta. I read a little bit, but I guess this guy. I saw what Nicole sent me on TMZ. What's it called? TMX, TMZ. Some that whatever celebrity channel where he talked about how bad his addiction was and he wanted to kill himself from prescription opiates. Give me a little background. There's others like me that we don't know anything about sports.
So the good news is, Dr. B, even though you don't know anything about sports, you have me here as your sidekick, and I do have a good amount of knowledge on sports. And especially that era is a time that I was kind of growing up and finding my own footing in the world. But I do know that we have an international audience or people like yourself that don't watch sports. So I'm going to do my best to capture for y'all the legend of Brett Favre, because it really is a legendary story, and it's a very appealing story because of how all the stuff in the news media was talking about, his addiction that he had. So just so everyone knows, between the years of 1995, 1996, 1997, Brett Favre was the MVP, meaning the most valuable player of the National Football League. So this is the equivalent of what we would call like a Michael Jordan, for example, in the sports of football. He was at the pinnacle of his craft. And in one of those years, he even won the Super Bowl. So you got to look at that in terms of this is a quarterback for the best team in America, for one of the teams that's really legendary and a lot of history to it, the Green Bay Packers. And this is a quarterback that's kind of leading the way and leading by example and just can't do any wrong. And Brett Favre, during those times, there's an Ironman record that he has, by the way, that I have to capture because this really shows the legend of him. Between the years of 1992 and the year 2010, Brett Favre did not miss a game of football. Okay, so he did not miss a game. It was 270 or 80 odd starts, including the playoffs. It was like 320 games. Never missed a day of work. And as you guys know, American football is a very violent, physical, tedious on the mind and body sport. So if you're not missing anything, that's why the label Ironman came to him. So recently in his podcast, I think in the beginning, late March, he opened up about his addiction. That's what was kind of circulating in the newspapers. He was talking about how at the peak of his addiction, he was taking about 15 Vicodin extra strengths a day. So he was going through one prescription bottle every 2 days. And he just opened up about it. And, in 2018, some of it came to light, but I'll tell you guys a little story about Brett Favre. So Brett Favre was born in a really small town, Gulfport, Mississippi. And there's a few incidents that I want to share about here that probably lead to, the development of his addiction. So he was always a star athlete, baseball, football, that kind of stuff. His dad was the coach of his high school team. He didn't really get looked at that significantly for different colleges. He barely got a scholarship in somewhere where he was a seventh string player. He had a long-standing history with alcohol, even as a youngin. So binge drinking was his thing. He always talked about drinking with his friends, drinking when they fish, drinking when they play sports. Everything was around drinking. When he was 19 or 20 years old, he got in a really bad car accident. He was driving 35 miles an hour above the speed limit, going down some turns, and got in a really bad car accident to the point that they thought he was going to die. They had to do emergency, your ER doctor here, so emergency surgery on him. They had to take out some of his abdomen. They had to, do some constructive work on the liver. They had to his long intestine. They had to, remove parts of his long intestine. Long story short, he didn't get in trouble for that car accident, even though he was annihilated on alcohol. there was a lot of enabling in the town that went on. He was the star, the star athlete of the town. They protected him. He never got a DUI, never got any legal troubles. And he went off, to continue playing college. And around the year, I believe it was 1995, he went to his first rehab. And the first rehab was purely for prescription medication, what we know as Vicodin. And back then in the early 90s, Vicodin didn't have too much of a rap, mid 90s. They weren't talking about the addictive nature of it, which you know better than I do. And, in 1994, right before that, he had another abdominal surgery for complications because of the car accident. And now he's just taking medications as prescribed by his doctor. And this is the peak of his career. He is destroying opponents out there. The society is patting him on the back. They're saying you can do no wrong. You are just, you're God walking on water type stuff. And it was about a year later that he actually went into rehab again. And this is his MVP year. So he's the most valuable player in football going into rehab again for 72 days. And there's stories about how when he went in there, he was only doing it because the league was making him do it. His wife was making him do it. The interventionist was making him do it. They were giving him a $900,000 fine if he didn't go in. And he kept telling the nursing staff and telling everyone he doesn't have a problem with alcohol. He's here to get off the pills, but he's going to continue drinking. He likes drinking. He doesn't have a problem with it. And they kept telling him, hey, you're going to come back here again if you don't stop drinking because you haven't been able to stop. And long story short, 1998, he goes back into rehab for a third time, this time only for alcohol. So he was able to get off the prescription medication. He only went in for alcohol. And, this is a time that, the stigma of mental health, addiction, seeking help, all that kind of stuff wasn't the way it is right now. And when the higher you go with athleticism, elite athletes, the more stigma it is to kind of go get help because you're supposed to have your S together, if you will, so, and you're supposed to be strong and make choices and all that kind of stuff and lead by example. And there's many times from 2000 to 2010, Brett Favre wanted to retire every single year, and he retired a bunch of times and kept coming back. There's stories that he just didn't like the limelight. So talking about some psychosocial stuff, he's from a small town. He didn't like being in front of the TVs, in front of the cameras, in front of all that kind of stuff. They asked him, what would you do if you retire? He's like, every Saturday, Sunday, I'll sit on my lawnmower and just mow the lawn. I miss mowing the lawn. So he was a simple man. But I'm really grateful that he's talked about openly on his podcast. He's got a big audience, man. This guy's like a legend. And it brought light to this conversation, which I'm really looking forward to. Now that you know the background of Brett Favre and his legacy and who he was and what he accomplished. And he has a lot of records, by the way. Every record you can imagine, he's in the top 5 for quarterbacks of all time. So now you can probably touch a little better than I can, Dr. B, about the innocent Vicodin addiction and the history of opiates and all that kind of stuff, which I just can't wait to listen to you talk. So thank you, Doc.
I just want to point out, I was about to start this documentary on him that looked really interesting. And it started off with him. He's got 400 acres, and he was getting on his tractor about to go at it. And he was saying, this is what I do every day, and I love it. And I was like, wow, it was done. It seemed to be done really well, and I didn't catch it. So this is great. And I think it's great when a guy like that, and he seems like a wholesome, good, constituted person, especially coming from a small town. In particular, regarding his specific case, it shows how some people are inappropriately protected and enabled, those early days that you were talking about. And that's neither here or there. But this gives me an opportunity. We talk about the opiate epidemic, and I'm just going to sort of focus on that for a second because to me it's a polysubstance epidemic, not just an opiate epidemic. And they talk about the opiate overdose deaths. And before the fentanyl, everyone referred to this issue as heroin. I'm going to go a little bit, I'm going to start from the data on the overdose numbers and then move backwards to the issue of prescription opiates and how that evolved. So everyone always thinks about heroin overdoses. And sometimes I point out on one of these channels that, listen, folks, the data from the, NIDA and all these guys shows that from 1999 till about 2013, when you talk about opiate overdose deaths, it was mainly prescription opiates. The only reason illicit. Well, you can get prescription opiates through diversion illicit as well. The only reason the other stuff kind of took off was around 2013 when fentanyl came into the picture, and it's a lot more easier to overdose on that. But it's always been prescription opiates, natural semi-synthetic opiates, and methadone. So that's one thing. So people should understand that getting pills or being addicted to pills, and when you're talking about Roxys are basically heroin, and they are basically fentanyl for all intent and purposes of the receptors they work on, and clinical pharmacology wise and behavioral wise. So that, keep that in mind. Now let's go back to this prescription opiate thing and the epidemic. We can go all the way back to, and some people may know this story, 1981, a letter to the editor, not a study, not a placebo, double-blind, controlled study, not a letter to the editor from Boston and to New England Journal of Medicine. And this guy was just kind of doing it. He's a good guy, a doctor, and he just wrote, look, we've looked at some of these patients here. This is something we need to look at, but it appears that our inpatient population, these internal numbers that we've looked at, when their pain is well controlled, they are not seeking any more opiates. Okay, that letter, again, it's neither here or there. It's for the practitioner to evaluate, think about, and delineate and take it a step further. When Purdue Pharmaceutical came into the picture here, right? And this is the problem I have with our society and our political, corporate economy and infrastructure. When Purdue Pharmaceutical came into the picture, they took that letter and they spent hundreds of millions of dollars over the next 20 years walking into doctors' offices. And back then, what doctors could get from pharmaceutical companies was quite lax. So nowadays, when people say, hey, I'm in the pocket of pharmaceutical companies, it's kind of funny because not only am I not, what am I going to get from them? I get a free lunch. And for the most part, I don't even allow them in my office. Most people that come to my office, there's a paucity of any ads except hepatitis C. So these guys spent millions, hundreds of millions, convincing the system without any data that, look, the research shows you treat pain and people won't seek the pain meds are non-addicting. I mean, that was insane. At the same time, it was sort of a collision of multiple things that happened, and it's very odd. At the same time, the black tar heroin started streaming up from Mexico, from a particular small village. They call them rancheros, right? And I believe that was Jalisco, not the state, but a ranchera. And these guys basically figured out how to become the McDonald's of giving you black tar heroin. So young boys would come up, 16, 17, 18. They would get recruited, come up to the States, and package this stuff in these $10, $20 bags, at your door service, discounts for buying 5 at a time. And so while this big push by the pharmaceutical companies, driven by Purdue initially, was happening, now this whole movement by the Jalisco boys was happening. And these guys would come, make a big dollar, and then shoot back down and have a big party, buy a whole bunch of Levi's. It's really interesting what happened with the money. They would have a big, they would buy a horse, be the talk of the town. So that started to happen. At the same time, the profound effects that now we're going into the 90s and 2000s of the economic devastation of some of our policies, including NAFTA and so forth, started to have a profound effects in places like Ohio, West Virginia, and so forth. Now you have the psychosocial things going on where people are just out of jobs. They're poor. I mean, it was just so you take these three factors, and I forgot his name. He did a great treatise on this. His book is great, and I forgot what it's called, and I forgot his name. He's a journalist, and these all came. And so, by the mid 2000s, a place in Florida, a place up north of that, these guys were putting out half the opiates prescriptions in the country, like, pill mill like you've never seen before. In addition to that, now at the same time, the buzzword was treat pain, and the BS pain scale, which is not really validated. And guys, let's say if you're working at a place like Kaiser, you don't treat it. This is when doctors became like basically any salesperson. You don't treat it. They make in complaint to whatever the hospital, and this you're a doctor. You're trying to work, and you don't need complaints. And oftentimes your bonuses and promotions depended on this crap, right? Now you're not acting like a doctor anymore. So all of these forces kind of occurred at the same time, right? And meanwhile, people are always talking about how doctors are the cause of this. And I always say yes and no, because, whether you talk about the medical establishment, the pharmaceutical company, the CMS, the Center for Medicare and all that put the pain scale, these are us. We are the society that consumes and demands and everyone, so it's everybody's fault. Okay. It is our complete global paradigm of the way we do things fault. And here's one other thing. And so, boom, you have this opiate epidemic, and it started spilling over into the white neighborhoods when this heroin epidemic was happening in Harlem 30 years before that, okay? Issues with Mexican Americans was happening 50, 60 years before that, okay? But who cares? Now it's the white, all of the Caucasians and the judges' kids and the senators' kids, okay? So that, now, one other thing I want to point out about it, okay, now we're talking about the opiate epidemic. We're going to pull back, okay? All right, what are we doing? We're doing number one, the epidemic is nothing new. I've traced these epidemics back to the early 1800s, where morphine was sold as the cure for opium addiction, when opium's primary main euphoric and addictive ingredient is morphine, right? And then eventually we went into civil war with soldier's disease, which was serious addiction to painkillers. And then we come up into the 20th century with amphetamines, then methamphetamines, then diet pills. This is not our first epidemic we've had. And our response is always the same: radical, thoughtless, inhumane, right? Now we have the foot of law enforcement on our necks. And I just recently read an article in the New England Journal of Medicine how, they're doing such an amazing job to curb the opiate epidemic. And the stuff on there was really, they're talking about prescription monitoring. They got their foot on everyone's neck. And the answer is actually quite simple. Change the structure of the social order, create education, create jobs, create mental health and addiction services, get rid of the stigma. And we are doing that same reactionary knee-jerk response to the opiate epidemic, which is not new. Like I said, we've had multiple epidemics, every single one caused by the pharmaceutical industry, literally, okay? And here we are again. Meanwhile, for example, right now, I put something up on gabapentin. 6,000 people respond. Everyone's on gabapentin for something. Meanwhile, there's a Lyrica epidemic raging in Europe and now starting here, which is a sister product, and it's the same crap. So that's my thoughts on that. And it's really important to me to get that. People need a historical and educated perspective on things, so the same thing doesn't happen. The answer is not to police every doctor and every pharmacist, because now I can't practice medicine. I'm bombarded with paperwork and watching my back to do things exactly. I'm the doctor. There's a medical reason why I do things, and I'm supposed to be self-regulating in my professional behavior. And a society should be created where I can do that and address every patient's needs, even the ones that are seeking drugs. And so those are my thoughts on that, Parham. And that's what I wanted to get out on that. And,
I'm really glad you did, Doc, because it just shows how that system, that machine, that whole entire mega complexity, how all that is so powerful that you get one of the most successful all-time legendary athletes that probably has a team of physicians that are all managing his care and looking at his blood and looking at his oxygen and all that kind of stuff on a regular basis. They were the ones, because of these articles, because of these the push by the pharmaceutical companies to say that this medication is not addicting. They are okay with giving this medication to someone who's worth millions, probably billions of dollars to the organization, because that's how it just infiltrated everything, our entire healthcare system. He said he took these medications because his doctors told him that they were not addicting.
Yeah.
That was his exact words. And he said, I didn't know that I'm going to be taking 2 a day and asking my teammates for another 2. I'm going to be getting a prescription here. I'm going to be a prescription there. He had no idea he's going to be getting illicit pills off the streets because his doctors, which he trusted because they're the world's best doctors, told him that these medications are not addicting.
So that's how insidious our cognitive paradigms are when we're bombarded with the same thing across the board. From every angle, it has to be reality. It has to be the truth, and I'm glad you brought that up. It's all and one of the things, fortunately, in some ways, I didn't own a television until I was 40 years old. And maybe some people think I'm odd in the way I live my life or do things or see things, but it allowed me to watch the world move in its often irrational changes in behavior and views by not owning a television. Because I'd be like, why did? And then I'd see the TV. And, I bring that up because, again, we're talking about an all-pervasive, systematic and systemic. It invades every institution, paradigms, and he couldn't. Even he fell right into it. And you are right. When you got Purdue spending $1 billion on marketing, the best doctors. Interestingly, I myself in this situation, little bit didn't fall into it for a couple of reasons. One, I was fortunate enough in the training ground that I had, and later where I was teaching and working, where these guys were just really good clinically. Two, the population I served and the position I had, I couldn't care less what CMS thought about me checking off a pain scale, and I sort of ignored it and was able to. And we would kind of watch all these guys getting these large prescriptions. And I was just fortunate in the situation I was in. I didn't get too caught up. Incidentally, orthopedic guys put out the most number, and I'm not blaming them for it. But when you're putting out pain medications, or if you're giving someone Suboxone or any medication, and I'm going to do a show on ADD, ADHD medication, you have to follow that patient closely. Think about who your patient is, how long you're going to put them on it. And there's so much to it, and a medication can be dangerous. And you're right. This guy just fell right into that whole situation.
Yeah, and when you were talking earlier about the amphetamines and the methamphetamines and all that kind of stuff, it just makes me think of all the movie stars of the 50s, 60s, all the musicians, that would play, 26 movies a year, this and that, and they just had those mama's little helpers, and they were keeping them strung out on amphetamines to be able to perform. So it just really made me think of that too.
Yeah, interestingly, a lot of those guys back then, before the benzos came out, there a lot of them overdosed on barbiturates, the overdose ones. It was barbiturates because back then there was no benzos till became big in
Mm-hmm.
the 70s, and that's another thing we should at some point hit. But the benzos, another hidden epidemic. Now they're more careful about it because of all this stuff. But giving frivolous benzos over the last 50 years to people has destroyed so many lives. And all of a sudden, as doctors, we just pull back and say, oh, I can't prescribe this anymore. And, you've had the guy on this stuff for 10 years, whether it's opiates, prescription benzos. I mean, it just goes on and on. We got a good thing
Yeah,
up here.
there's a lot of meat and potatoes in the side chat. I'll tell you that.
We'll get some on. Hey, guys, on TikTok. Again, I'm old, I'm blind, I can't see the writing. I'm trying to pay attention to Parham up here. If you have questions, it's simple. Go on YouTube, Dr. B Addiction Recovery. It's totally easy. You can ask your question. You can come on live, and if you don't want to show your face, you can do that. Hey, we got someone. Abe Kumar. I'm going to add him on and ask his question. Sorry, I didn't see. I think it's Abe Kumar.
Hello.
Hi, how are you?
I'm doing good. I'm from Delhi. How are you?
From Delhi. What's up, Abe? Nice to meet you from Delhi.
Yeah, nice.
Cool.
Nice to meet you guys too. I found the channel really helpful. I have been a poly addict. I've been addicted to multiple substances, and I found the YouTube channel really helpful.
Good.
It talks about a lot of things that I think people should know about addiction and detox process.
Good. Thank you. It's been helpful to you. How are you doing in your addiction and treatment over there?
I'm slowly weaning off. Opioids have been an issue, but I'm slowly weaning off them, trying to control the dose, switch from heroin to codeine, and then controlling the dose of that codeine to below 200 and 100 milligrams.
Is there methadone or buprenorphine products out there?
No, they're illegal in my country. I can't really get them without going to the black market, which I don't really want to do.
I understand. And how about the care? Is there good mental health or medical doctors to assist in what you're doing?
Well, the mental health access all over the world is pretty terrible. I mean, in India especially, the culture they don't really think about mental health in the way the Western civilization does. They think that mental health is not a real big problem, and people can just go on with their business and just suppress their feelings for a while and just go on with their business.
I thought that was changing a little bit over there, but so is your doctor aware that you're tapering down? Is anyone helping you with that?
Yeah, I've got a psychologist. She used to be my teacher, and then I asked her for help, and she's now helping me.
Good. What other drugs are involved?
I see benzos are a really big factor. Benzos are really, really addictive. And alprazolam, it is sold as Alprax, commonly called Xanax. That is a big thing that I used to be addicted to. I used to consume a lot of it, like 8 to 10 milligrams, but I'm now weaning off to 0.5 milligrams, 0.1 milligram, 1 milligram, just that dose, just a therapeutic dose.
Abe, how old are you?
I'm 21.
Well, you're young. Okay. Are you in school? Are you living at home?
Yeah, I'm at home. I'm basically living with my mother, and I'm in medical school. I'm learning physical therapy.
Oh, good for you. You're becoming a physical therapist. Is mom and family supportive of everything that's going on with you?
Yeah, they are very supportive. They're very helpful with everything that I need and done.
Parham, feel free to jump in
Yeah,
anytime.
uh,
Go
for
ahead.
sure. Thank you, Abe. That's really well spoken. First of all, thank you for giving us a lot of insight, and it sounds like you're doing a lot of education and you're trying to learn as much as you can given the limited resources that you have over there in your country. If you don't mind me asking you, what got you into using substances in the first place? So when you picked up the heroin or you picked up the benzos or and this and that, what got you caught up in the cycle of addiction?
So I was in a hostel dormitory. I was just sleeping, and one of my friends he introduced me to cannabis first. So I smoked some cannabis with him, and then he one day he just came up to me and he just told me, let's just go score some heroin off the street. And then we just went and got it. And the first time you consume heroin, it's not really good. You don't really get the full high. So your body wants more. So you get into that cycle. And then you want more and more and more till you get the first high. But the first high never comes.
Yeah, we call that chasing the dragon over here. You keep chasing it until trying to get it back. How long ago was that for you when your friend approached you with the cannabis and then later on you guys escalated to the heroin? How long ago was that?
And that was about 2017, I think.
Okay, so you were young. So it was about 17 years old that you tried heroin for the first time?
Yeah,
And despite of
17
your
turning into
addiction,
18.
yeah, despite of your addiction, you've been able to move forward with your some of your personal goals in your education?
Yeah, I left that college in that hostel dormitory. I left that. I came back to my home and I joined another college and I made a new friend circle, new college, everything. Changed my life basically, turned it around.
Okay. What did and in my last question here, since I'm the more clinical side of things, when you use the cannabis or you use the heroin or later on use some benzos, what does it do for you? What's the payoff? What's the reason why you keep using outside of the physical dependence? What do you get out of addiction?
So basically, it just calms me down. It's just like the voices, like in the mind chatter in your mind. There's a lot of mental chatter, right? If you can't control it, it goes out of control and creates a whole dragon of its own, a leviathan, if I may. So that thing, the mental chatter, it's really hard to control without drugs. So you seek nicotine first of all. Like the first thing you seek is nicotine, and then cannabis, and then harder drugs like opioids and benzos or alcohol.
I got you. So it helps you quiet your mind.
Yeah, helps me calm down, sleep a bit better, and all that.
Yeah, so my as a clinician, since you don't have access to too many clinicians over there, my suggestion to you would be to find out why, when and where your mind started to get louder, when and where you started to experience anxiety, when and where you started to have a little bit of discomfort in your own skin, because it happened before you picked up the drugs. You see, because the drugs was a solution to that condition you were experiencing. The drugs helped you find a way to calm all that down. Now, here's the thing: as you're moving through titrating off the drugs and you're trying to wing yourself off and detox off, what's going to happen is all of that stuff that you experienced a while ago when you're 16, 17 years old, it's going to come back up again. So are you going to be able to find ways to quiet your mind without the use of substances? Are you going to be able to fall asleep at night without substances? Are you going to be able to be comfortable in Abe's own skin without substances? If the answer to those is yes, then you're going to be you have a better chance of staying away from drugs. If the answer is no, that's what you have to go figure out and learn ways to do that. That's what you should seek out, learn as much as you can, learn about anxiety, learn about natural coping skills, learn about emotion regulation, because that's what you're going to need in order to get off these drugs, man.
Yeah,
And
I got the point.
and I have sort of the same point and question. What is your? I mean, it seems like you're a pretty bright guy because you were able to sort of figure this out pretty quickly and make changes. And I'm presuming you did this all on your own, but nevertheless, and you told me there's a scarcity of good professional resources long term. Do you have a plan to do this? Besides your psychologist, are you making some headway in that area? Because you're 21, you got a long ways to go to live, and it seems like you're doing all the positive right things. And Parham pointed out, educate yourself, which you seem you're doing. Tell me something I can put my teeth on a little bit more. Do you have any long-term, anything long-term in your toolbox that I can feel a little bit more assured about?
So let me tell you my long-term thinking. Basically, I was a hardcore opioid addict. I needed that stuff. I was chasing the dragon, as you say. So basically, long term, what happens to opioid addicts is either they quit opioids and continue on with their life, either they stick to opioids and they overdose and die, or they either continue on and off and on and off and on and off, in and out of rehab. They never leave the drug, they just continue using opioids all their life. So I got three choices: either I die of an overdose on opioids, either I stay on and off and on and off and on and off of opioids, or either I just quit them once and for all and move on with my life. So out of those three choices, the first choice clearly seemed the most logical to me, that it's a chapter in the past and I should just close it and move on with my life.
Okay. Okay. All right, Abhay. Thank you for reaching out to us, and we love you supporting us. Come on anytime and give us feedback on your progress. We are here to support you, my friend.
Yeah, I will follow your streams. I've already been sub to your channel, and I love the work you're doing, Dr. B and Parham. I really love the work you're doing. Thank you.
Thank you
Thank
so
you.
much, man.
Thank you. Have a great day. Pretty cool, huh?
Yeah, those are my favorite, man, with the international. And you know, the questions you ask, I really appreciate them when you start asking about what does their healthcare look like, because the world is really big. And, a lot of people on our side chat might be from the United States, and they might think that the way that we deal with addictions is the way that addictions is dealt with, or mental health is dealt with in the entire world. And even though there are some advancements in India, I know, like this gentleman talking to us right now, he probably sounds completely different than the generation before him. So they are making progress with it. But culturally, there are certain things with mental health that just aren't where we are right now. I mean, what the conversations me and you have every week about adverse childhood experiences and trauma, some parts of the world don't even care about that kind of stuff. So they'll get there, though. They'll get there because there's a lot of information, knowledge, education, engagement. The world is connected. So they'll get exposed to it, but it's not at the same pace sometimes Europe or the United States has.
That's interesting. And hopefully on the channel, we can deliver some of this insight to those out there and be support for them wherever they are. And some places are much more advanced in that in terms of access to resources and cognitive engagement into the root of all this crap. But it's wonderful, and it's always educating for us as well. So that was courageous of him, and I wish him the best, and I hope he comes back and tells us a little bit more. Let's see. There's a lot of stuff going on here, and quite a few people on TikTok. Guys on TikTok, please come on over here. We want you. And this last young man didn't even show his face, and he came on and spoke. We love to see your face, but if you don't want to, don't. Let's see. Parham, look for. Wow, there's so much stuff.
There's a lot. Yeah, you can find anything. I'm okay with anything on that side.
All right. Hi, Nicole. We see you.
Let's see.
Gail, I'm answering on YouTube. So come on up here if you want.
What timestamp are you on? I'll start from there. And
I'm at 1:51 p.m. Okay. TikTok guys, hi, Trish. Come on YouTube if you can. We will answer your questions. Like I said, I can barely see.
There's one at 205, just because I assume someone else is going to have this question. I don't know enough about it, but I'm pretty sure you have a good insight. 205, the name was Sukiyaki. And the question was, am I allowed to use CBD oil while on Suboxone treatment, or is this a deal breaker? The only reason I'm asking is because especially in our region of California, there's a lot of CBD use, and it would just be a good question for you to provide some insight on.
Yeah, it's not a deal breaker. I'm assuming there's no THC in it. No, it's not a deal breaker. A lot of people smoke even pot on Suboxone. I don't advocate smoking pot, but CBD oil, I'm presuming you mean skin oil and so forth. It is okay, Suki. We got our buddy here. Hold on, let me get her up here. Let me get this off. Thank you, Suki. Hey, how are you?
Hi. It's good
What's
to
up,
see
Terry
you all.
Farm?
Yes, you guys are covering a topic I just am very passionate about today on prescription drugs. And there's so many just that it's an easy thing to assume that prescriptions, just because they come from a pharmacy, are safe. And that's not necessarily how it always is. And I guess I think it's important just to notice just the whenever someone does prescribe a medication and it's dispensed, just like Dr. B said, it's not cookie cutter, and take the person into account, and also just to realize we can't be just filling prescriptions or writing prescriptions as medical professionals without stopping and considering the dose and all the different patient all the factors that they are facing.
You bring up a really it kind of woke my brain up on some of these issues, which I used to teach residents and stuff. So unless if it's changed, we are one of maybe one or two countries on the planet that is legal for pharmaceutical companies to do direct consumer advertisement. Now, all of you out there and you guys on TikTok, go online and take a look at some of the pictures and magazines and the old ads for Roxy's and all that stuff. It's okay. So there's places in the world where if you went to, and even a blood pressure medication, if there was a direct advertisement, they would kind of look at it as odd and weird. And it really, as we have seen the devastation of this kind of thing over many decades beyond this, oh, wow, new and novel opiate epidemic, it's really like this, folks. It's almost like, let's say, if I was a nuclear physicist building nuclear power plants, and, I'm not going to understand the crap that he's dealing with, and the cylinders and the turbines and this and that. And, some guy someplace wants this or whatever, and they're advertising to me to go advocate for this to be there. It really is like that. And one of the things that I've noticed, I am 50 years old. In July, I'm 50 and a half. So in July, I'll be 51. And sometimes I look back to when I was a child, right? You go to the doctor for clinical advice. And part of that is, does he want to add a prescription? When I moved from my old career of medicine to this career of medicine, I was really offended and shocked. Parham, I don't know if I've ever shared this with you. People would call and say, oh, I want Xanax. Will he give Xanax? Or I want this, or I want that. Mm-hmm. And it was because I came from such a pure practice of clinical medicine. I was like, what the heck's wrong with these people? What do they mean I want this? you can see me for a clinical evaluation, and I will give you feedback of how to go. But so this was odd to me. Number two, I did a little something somewhere, I think on YouTube. It's really weird. When I was young, you read the diagnosis on the bottle. Now I'm prescribing some hardcore crap, right? Whether it's methadone where I do methadone in Hollywood, or whether it's Suboxone or benzo, whatever it is, right? These I noticed most people couldn't care less or know what's written on the thing. So
Yeah.
quite a bit of and they go to the pharmacist, same deal. Like, they demand it. And, so part of my practice and what's happened in my patient population is really re-educating them about how to engage with a healthcare professional. So, they call, they're like, well, let's say there was a cash patient. If I pay, am I going to get my Ambien? What are you talking about?
Yeah.
So, we forget what it's supposed to be. And that's because we have become a world of hyper consumers in the US and certainly in California. And that's spilled over into what we do, healthcare professionals, guys. And you made me.
Sorry, go ahead.
No, you made me think of all that.
Yeah, I was just gonna say it's amazing how many times I have had people come in and they haven't even read what is on their label. It'll say take 1 tablet every 6 hours. And I think some education that we can do is the first time on some of these. We know prescription medications have some addiction potential in certain classes. And just to notice if you find yourself starting to take 1.5 every 6 hours. And then 2, talk to a doctor or a medical professional. A doctor, you need to talk to your own doctor that knows your circumstances before. Just that's one way that we could help prevent it. At this point, I think prevention is something that I want to help with so much, as do what I can to help educate.
And I think you are, and this actually spills over to you, Parham. I'll point that out, but I make it really clear to my patient population, and I tell them we are going to be in a clinical marriage, okay? And we're going to be in a clinical marriage, and my job is to educate you. And then we make a decision together. And if your decision is not what I agree with, I may go with you, but I will clinically advise you. And sometimes when your decision is outrageous, I also have the right not to participate. And little by little, people get on board and it creates honesty. Now, what we just talked about spills over to Parham's world. Parham, I know right now you strictly, I think, do substance abuse, but another thing where I was, talking to a psychologist at a university, 60, 70, 80, 90 years ago, people would go to a mental health professional for transformation because they realized there was an issue. And oftentimes, it's okay. In fact, most of the time, we are accountable and responsible for our behavior, emotions, and psychological states, even if it's caused by something or someone else. And everybody was comfortable with that. So you went into someone like Parham, and he called you out. And one of the things that I believe has happened even in Parham's world is people are going to therapists, psychologists, whatever, for validation. Oh, my, whatever, my boyfriend, my husband, my kid, he just said this and this. Can you believe him? Oh, my God. And, they're just validated. And so this kind of attitude, I'm paying you money or the insurances, whatever. I'm here. It's a service. You're going to make me feel the way I want, even though I have no idea what your game plan and expertise is in getting me to an evolved place, whether it's substance abuse, or I don't know, depression, anxiety, marriage problems. So, that's my thoughts, Parham. If I'm wrong, tell me.
No, I mean, there has been a shift. So one thing I want to highlight here and is so I believe that everything's mental health when it comes to clinical components, like the therapy component. I believe that everything's mental health. Now, I'm in a field of, I'm a licensed advanced alcohol and drug counselor, but I also have a master's degree in marriage and family therapy. So I'm actually a hybrid of both worlds. The flaw and the lack and that happens in the substance abuse world, for me, substance abuse treatment world, is kind of heartbreaking. And here's why. And this isn't because of bad intentions. I promise you that. Majority of the counselors and practitioners in the substance abuse treatment field don't have the level of education and expertise to be able to treat with mental health issues. Now, whether those mental health issues are a byproduct of substance use, getting depressed because you're using a lot of alcohol or whatever it is like that, you still need to have a level of education expertise, at least a graduate level, a therapist, licensed clinical social worker, licensed professional clinical counselor, a licensed clinician, to be able to know what you're looking at. So the field of substance abuse has many wonderful human beings that are certified alcohol and drug counselors, that are registered alcohol and drug counselors. They might not even have a college degree. Some of them might not even have a high school diploma. And they're there, and the only thing that they're using for treatment is their own personal history and their own personal experience and what they've seen work with other people's, just kind of as a formula of success. So the assessment component of treatment's not happening. The true assessment, you're talking about people come to your office and you say, I offer a full clinical assessment. That piece can't happen, because if the counselor doesn't know what an assessment is, how can he or she assess one person, So that's the part that I think it's falling off. So when an individual with entitlement says, I have insurance, goes to a substance abuse treatment facility, they're going to be able to run wild, because they feel like they have the leverage, because without education, you don't even know what you're doing in there. I mean, oftentimes, I know that was my case when I was just a drug alcohol counselor, 10 years ago versus the person I am right now. I'm a completely different person in the room. So if someone came in back then, had, wanted to run their own show and get, just waste time of the group and just kind of hear themselves talk, I wouldn't have been able to intervene. I wouldn't have been able to stop, redirect, reframe. I wouldn't have been able to, healthy confrontation. Now, if they did that in my group, it's not going to work out well for them, So, and that's because of experience in education. So That's where I think the lack is, Doc. It's not the, it's not the people have changed too much, because, you sit in front of a good clinician, they'll still be able to call it how it is. They'll be able to confront you, use that Gestalt approach of, bringing up awareness. They're able to do that. But when you go down the substance abuse field, man, it's just, unfortunately, they're not there yet.
I think it's all related. Again, it's the corporate financial structure of how payments are done. So I think it's all related in the same degree that the patient or the client expects a certain thing. The system's been set up to deliver that thing if it works. So you are absolutely right. That's a major issue, but I do think they are related.
I do agree with you, by the way, on the last point you made. I do agree with you on that. The system as a whole. Those counselors are just one part of the bigger system.
Yeah, I think everything's related. I'm just as responsible, even myself now. Lack of time to do what I want to do. So it's all around, guys. And the pharmacists, have you seen these guys? They're just putting these prescriptions out. They're so busy. Even if you go to an inpatient hospital pharmacist or ICU pharmacist, which are really fun to deal with, but most of the pharmacists are working at retailer situations, and this stuff just comes with these algorithms and protocols, and these poor people are just moving, right? And cookie cut. I've seen it. I know them, and you're like, my God. So it sucks all around, and I'm sure that Karen Pharma has experienced that herself.
Yeah. It's fast paced, and when I was in some settings, I'd work 12-hour days, and there's not really time for any breaks, and you don't sit down once in a day, and it's just, you just are trying to reach every patient. I guess that's the challenging part for me. I think that was hard, was feeling like I wanted to change and help and affect every person. And it's
I think. Oh, go ahead. No, I was just going to say, I think when you're up to going back to work, you're going to have to move to a small town. And,
yeah,
I want to do the same thing, but that's what you got to do.
yeah,
It's just a different world.
yeah. Well, I sure appreciate you guys just discussing these important topics, and I think there's a lot of, hopefully we can do what we can to help prevent this in the future. But I think, like Dr. B and everyone's talking about, there needs to be social change, and just I think some of the guidelines I was seeing, even they're considering like being able to look at genetics and then also trauma informed prescribing practices for just the risk of addiction on certain medications.
Absolutely.
So just some of those things hopefully will help. And then I think also, just for my all my surgeries and my ICU care and all of that, I guess I see a change in how opioids are being used also. And I guess as a pharmacist, I have changed how I counsel people on them too. Just it's so much, you want to use other medications in combination, and really trying to if you can wean there. Opioids have a place in acute pain, but long term, there's I think we have a lot of people that are on them now, and it's just trying to, we can't every situation is different and every person is different, but I guess I think they're using a lot of other medications in combination to help now.
Yeah, I think this is actually a great topic, and we should bring you on because this is a topic I really discuss a lot in my everyday life about what's happening. And at some point, we really want to touch this topic somewhere down the line. I don't know where, but thank you for coming on. Always come on, stay with us every week. We want to watch you through your battles and support you with everything you're doing.
One day at a time. So
one day at a time.
Yep. Our pain can become our purpose and become our passion. That was a quote, can drive us. So we can shift it to something positive, and that's what I'm working through. So I appreciate you guys, and just keep helping people there.
Thank you. We'll see you soon.
Thanks.
Bye. Okay. We got C Glue. Hi, C Glue. Thank you for waiting.
Yeah.
Okay.
Hey, Dr. B. I've reached out to you before. I was previously maintained on Suboxone, and I've been on Benzos before that for 6 or 7 years now. Xanax, 3 times a day, 2 milligram. And I was just having severe respiratory depression from small doses of Suboxone.
You mean right now?
No, not anymore. I'm no longer with that clinic, and I've transferred into the Kaiser system. And the way that they see recovery is a lot different, especially if you have chronic pain. The way my doctors explained it to me is they'd rather, if you can tolerate a medication like Norco or Percocet, they'd rather see you on that than Suboxone. So it's a very
go ahead and give me. So I'm aware of this with Kaiser. I usually don't bring it up, but go ahead and please give us your tell us what you want to communicate. But yeah, go right ahead.
Well, a lot of my uses. I'm a two-time wildfire survivor in Northern California, the Camp Fire near Paradise, in 2018, um, and as well as the other fire that just happened on the other side of the mountain this past fall. And I've suffered from severe respiratory issues, which is what has driven this. I don't respond to dextromethorphan or anything like that very well, and doctors are so hesitant with the codeine prescriptions, but that's why my doctor gives me hydrocodone, because he sees that as a I to be honest, I did resort to Suboxone before I was in Kaiser, because I knew it would hit my immune receptor and drop my cough control center, and now I could breathe better. But then I noticed I was starting to get to respiratory depression towards. It would make me nod off. It started to destroy my relationship with my family, because like, why are you so not yourself? And then when I started with Kaiser and they put me on Tylenol 3 and then worked my way to hydrocodone, everyone in my life has told me how much better I look and how much better I sound and am doing. So there's definitely a lot of trauma involved with my pain, because it comes from these wildfires up here. So that's what I think as an interesting viewpoint. The doctors was willing to give me plain promethazine syrup on top, and I don't have any respiratory depression with the benzos and the promethazine with Norco. But Suboxone, it seems to be like, for me, a problem, as other stronger opiates are for other people.
Sure. Thanks for this feedback. Let me ask you a couple of questions, and then Parham, I'll let you ask whatever you want to. I'm curious. What dose of Suboxone were you on? That's my first question. And by the way, these are for pain. Is that what the issue is?
Pain, and I had after these wildfires, the palpavir somniferums came back, and
Okay.
so I started making teas, and I was having really bad withdrawals, but I was using them for cough and pain. I got in some accidents on the way out during evacuation. I've had trees fall on me. I can turn on my cam. Let's see if I can flip it around. But I mean, where I'm sitting, this whole place is charred out.
Oh, it's beautiful though.
Yeah.
Bird.
Paradise is just over there. I can walk through my garden. I'm a farmer, so that's where my, I probably walk 25, 30 miles a day on my 20 acres. So, it's just the way Kaiser sees it, and I never had any other doctor. My previous doctor, who died in March, was a psychiatrist up here in the North State above Sacramento, and he was the first doctor approved for esketamine treatment, or Novardo. Is that what it's called? Yeah. So he suddenly passed away in March, and it was really hard for me to get my benzodiazepine prescription, and I realized in those withdrawals how deadly they were and how hard it was. But switching through my medical system, now I telehealth from Los Angeles, and they still give me 2 benzodiazepines, alprazolam, 2 milligrams 3 times a day, and now I'm on triazolam, 0.5 milligram at night.
And so, go ahead.
I have like a lot of severe PTSD.
Yeah.
My panic disorder has been increased, especially with the weather getting a lot drier. Fire season is going to be coming right around the bend, so my PTSD is going. Anxiety is extra high for the last couple of weeks for a reason, and I still have 100 Suboxone stashed, the 8 milligram and the name brand, but I get these temptations to use them when I get in severe pain, and
let me. I don't want me. I want to sort a couple of things out, and there's a piece there I want to turn over to Parham. Now, when you were on Suboxone, what was your dose and what benzos were you on? That's my first question. I'm going to give you a feedback on a few thoughts, and then I'm going to lead it right into Parham because I think he has a lot to say on a couple of things. So, what was your dose of Suboxone, and what benzos were you on at that time?
I was on alprazolam and 3 milligrams at night, and the same alprazolam schedule throughout the day.
It's a horrible connection.
It just varied by how I felt. I'm sorry. Is this better right here?
Yeah, I think so. Yeah, I just want to know the dose of meds you were on
Okay.
in detail when you thought you were having problems.
Yeah. So I never took a full 8 milligram because taking about 2 milligrams or 3 milligrams was almost too much. And then I started getting this huge tolerance, and I was vomiting all the time, and I couldn't walk straight. And I have that severe. I don't know if that was due to the benzodiazepines, but like some days I never took any more than, I would say, 4 milligrams a day or 5. But I was prescribed 16 with barely any oversight.
Yeah. See, Glue, it's a horrible reception, but the thing I wanted to say was a couple of things. One, when you talk about respiratory depression, you were nodding off, which falls more under euphoria than respiratory depression. Respiratory depression is a very specific thing in terms of clinical urgency. Nevertheless, it seems like the dose was too high and it needed to come back. The reason I was asking the benzos was I wanted to know how much benzos you were also on. Whatever was happening with the Suboxone, I would have personally switched you maybe to a different product, Subutex, buprenorphine, and control the benzos. That's neither here or there. But the other thing I want to say, which is concerning, it's clear that there's a lot of PTSD issues and so forth, and you got to deal with a lot. My only concern, and I have a few Kaiser patients that eventually came back to me, is I have no problem with that. I got a guy on 32 milligrams of Suboxone, and I also give him promethazine, and I know what promethazine is, and I've seen it abused, and I've given it with Dilaudid in the ER and seeing people go to heaven with it. So, but again, if it works for somebody, great. My concern is you're a young man. Over the next 10, 15, 20 years, I want to know from Parham's perspective, how is everything else being addressed? Because having, the Xanax you were telling me about is a pretty chunky dose, right? And do I want a young man on that dose for the next 10, 15 years? And what is the long-term plan? And also, if you get into a situation, now you might be that one person, and there is a few here that I keep on, Vicodin or whatever, but when that stressful situation comes, what's going to happen to your agonist opiate medication dosing? And I'm going to let Parham give his feedbacks on some of these thoughts I have. And this is stuff you got to work out for yourself because I don't have enough details. But just in general, these are the kinds of ways I approach patients. But Parham, please.
Yeah, what's up, Siglu? Thank you for sharing all that information. I can give you some insight that I gathered from what you were saying. At least maybe it might be helpful to you. Is the same amount of kind of thought process, the same amount of thought process that's going into your different medications, the amount of information the amount of knowledge the different things that have worked, haven't worked. It seems like you've invested a lot of time, energy, effort into the medication piece. And I'm telling you this, that the same amount of time, energy, effort, motivation needs to get put into the mental health piece, because you first of all started off saying you're a 2-time fire survivor. So I know the psychological, emotional pain and just the grief and loss that comes with something like that. And my question to you is, did you also have substance abuse issues prior to the fires? So growing up, was there also, you talked about anxiety coming back, or your panic attacks coming back, that kind of stuff like that. When did it all start from you before the fires?
Well, when I was younger, I went and actually was did SPECT imaging at Dr. Daniel Aben's clinic. I believe when I was 14, because I think I was falsely diagnosed with ADD at age 6. I was put on Adderall at age 6 in elementary school, and I started having weird behaviors and throwing my, hiding my food, and then like hiding my pills, not wanting to take them, to like the way it made me feel, and that progressed on to me being put into a special ed program in middle school. And I think I had some separation issues between me and my normal friend group. And I kind of have some, I'm kind of disappointed with my mom for just putting me into that without giving me a chance of being, to figure it out. I was really young, and, moving on to high school, I kind of transitioned out of that, but I think that's when my substance abuse started. I started experimenting with mushrooms and, LSD and ecstasy, and I actually tried opiates once then, but had a horrible experience and didn't see what the whole hype was about. This was about the time of the OxyContin surge. It's the little suburban town I grew up in Northern California had the highest rate of OxyContin abuse among my age group, and all my friends were smoking it. And I had no interest in it. I really was into cannabis, and that's still my heart and soul. Where I live, above Paradise, every parcel here is a black market cannabis farm, basically, because our county won't get on board with regulations. But I'm kind of trailing off, but it kind of shows me my path. My trauma definitely started early on in my childhood, and I think cannabis was the first thing that I used to kind of it changed me. I stopped getting in trouble in high school, and started behaving and doing my homework. And I mean, I got my recommendation when I was 17 years old. My mom went in to the doctor's office with me. So my parents have always had an interesting stance on my medications, and they're the same ones that don't want me on the Suboxone at all, because of how it changes me, and I become dysfunctional, and I feel like it drives more addictive behaviors out of me.
Sure, man. So you do have a decent amount of insight regarding your upbringing, the traumatic experience of being put into the individualized, education plan on a track away from your friends, some of the resentment that was, stemmed from that towards your mom for not kind of giving you the opportunity to be able to figure it out on your own because you were a young kid. And then you got into the experimental stage, which sounds like it was just age appropriate stuff. It doesn't seem like you were, going off the deep end at too young of an age. And then when you found pot in forms of for you medicinally, it was something that was able to calm you down. And so when did the other drugs start to show back up?
So about the time, actually, I bought this piece of property I'm on right now, and coming up to the area called Chico, which is notoriously the biggest college party town in California. I met a friend who also had property up here, and he took a lot of Xanax, or Atisalam. Now I know, because I have been prescribed Xanax for so long. I know the difference, and a lot of pressed benzos, basically, and I just fell in love with the feeling and how I felt. I could just go on with my day, and I had no stress, and that's what I told my psychiatrist at the first visit, and that would be 2016. And he immediately started me on Xanax, and that medical paperwork I've carried all the way till today. Like I said, he just died in March of 2020, so yeah, that medical paperwork has saved me from there so I can still get my medication. But so I guess the benzo abuse started pretty heavy in 2015, and or maybe 2013, and then my I would say the opiates started when I really started drinking promethazine with codeine, when it was a lot more available and cheaper. And then had my doctor prescribed it a couple times because harvest season in farming, I also have hay allergies and stuff like that. And that was the Suboxone doctor, because he felt I didn't have any sort of urge for I had no OUD symptoms, so he would prescribe that to me from time to time. Like when the campfire happened, he prescribed me a pint of it, and that really helped get me through. But I feel like I used it partially for emotional trauma at that time, and not so much for my lungs. Even though we were at 300 or 3,000 air quality index, which is virtually impossible to breathe outside. It was kind of like a crutch for me with everything. And then from there, I actually tried oxycodones for the first time. And so that would be 2018. And then after that, like I said, the Papaveres came back, because there's the old Asian herbalist right down the road that had a hospital, and he used to cultivate them all up and down this hill right here. So apparently after wildfires, they come back. So I knew what they were, and I started using those, and I guess that's where it kind of slipped. I was doing morphine or MS Cotton 100s and getting the new formulation of P80s. I just didn't want to, I wasn't trying to overdose or harm myself. I just didn't want to, they were completely killing all emotional and physical pain from all the trauma from this fire. I mean, it's really taken a toll on our community and the mental health out here, and physical for a lot of people. I'm lucky to be where I'm at today. So
yeah, it sounds like it, man.
On that.
Yeah, it sounds like it, man. I mean, I'm not even going to act like I can assume I understand the psychological, emotional pain that goes through the wildfires in a community like that. But I could tell you this, that based on the way that you typically have been responding to the amount of stress and anxiety and trauma in your life, that if in the future, God forbid, there's another event, you can't continue using the same formula, because this thing ain't going to last. It's not going to work long term. This is it's probably the unhealthiest version of coping skills that you can do, because the more emotional pain you get, the more you're seeking out substances to help you with the emotional side of things. So I strongly suggest, man, the same amount of time, energy, effort you're putting in the med piece, get some referrals, get the community base. I mean, there might be just a bunch of people in your community that can get together and have a support group just to talk about the anxiety and the fear. I mean, I'm talking about just like random people in your community. You know, you got to get out there and you got to connect and you got to identify and you got to get out of this fear that you're experiencing, because it's going to be a lonely place. No one knows what's going to happen in the future. Hopefully you don't have to go through that again, man. But the way you've been dealing with it in the past, and you know that, you wouldn't be talking to us right now if you knew that something's not wrong with the way you were dealing with it. So yeah, but just hope. I'll keep you in my thoughts and prayers, bro. I really will.
I really appreciate it, guys. And Dr. B, I always appreciate your videos and watch them all the time. It helps me out. And
we appreciate that. We support you. Come back anytime. We'd love to hear your story, and thank you so much for sharing. Come on and get our feedback anytime, man.
Okay. Hey, thank you, Dr. B and Parham. You guys have a great day.
Yeah, you got it, bro. Thank you.
Be safe. Okay. Well, I wish he was closer to me. So there's a lot of stuff there that I think we could sort through. Let's get Zach on. And hi, Zach. Thanks for waiting.
Hi. Can you see me? Can you hear me?
We can.
I can see you too, Zach.
Okay. Hi. B. Hi, Parham. How you
What's
doing?
up, bud?
Hi.
So, yeah. So my situation's pretty simple. I can definitely relate with Siegel about his wildfire experiences because back in 2015, sorry, I'm a little anxious right now. Uh, Back in 2015, we lost our house in the Valley Fire. So I live in Lake County, so I'm not too far away from Paradise. Actually, I'm about 2 hours away. But basically, my situation is I'm on the Suboxone. I'm on 2.5 strips, 8 milligrams, so 20 milligrams, I believe. And my doctor does not want me taking Xanax or any other benzos. So he said that if I continue, he's going to cut down my Suboxone. So basically, what I'm trying to figure out is if I can get a benzodiazepine prescription while I'm on my Suboxone, because I've spoken to a psychiatrist and he suggested Paxil and hydroxyzine, and I don't really want to take those medications because I'm already on a lot of medications, and I've tried Prozac for depression. That doesn't seem to work. So basically, with the Xanax, it's like 1 to 2 pills, 2 milligrams a day. I even write down my dosages in my journal. I have all my dosages written down since like March. So all my dosages are all written down here every day. So I've been taking them daily. But I'm just kind of struggling because I feel like my doctor is punishing me for managing my anxiety illegally.
Parham, shall I or?
Yeah, you can start off. This is medication first, so.
Yeah, so there's a lot here. And again, usually in my personal care, this stuff eventually, once we stabilize medication, then I do as much as I can in terms of counseling, emotional, psychological support. Then I turn it over to the rest of my team because I see the thing. So, two, I want to reiterate to everybody on TikTok and on this thing, we are absolutely
By the way,
not
hi
giving.
Nicole.
We are
She knows
not
me.
giving. She does. Yeah. A lot of everyone
Yeah.
knows them. We are
Yeah.
not giving medical advice, and neither one of us. And these
Yeah,
are complex cases. And in your case, I really want to drive that home, Zach. I'm going to give you how I approach in general with very limited knowledge that I have. I'm going to make an educated speculation, and I don't know your psychiatrist, so I don't know what he's thinking, but I will give you some feedback and thoughts, okay? Number one, I have quite a few patients that is a complex repertoire of medication management because they are in that state where so much crap is going on. And for me, a large medication is 4 or 5. Usually people come to me to get those down to 2 or 3, and these guys get 7. And these are all pretty potent medication. Now, I don't know what else you're on. I don't know the history of the anxiety and so forth, but I can tell you this. In general, most practitioners are not kosher or there's quite a few practitioners that are not going to be kosher with 20 milligrams of Suboxone and Xanax, okay? In general, purely without the human being involved, that in itself, if he's concerned about respiratory depression, it's just not there, okay? It's not an issue. If there's, I don't know how he's thinking or what he's thinking or what else you're on, right? I have patients that'll come and say, hey, the doctor tells me if I go from 20 milligrams to 24 milligrams, I have to cut back my Klonopin to 0.5 milligrams because I'll stop breathing. It just doesn't, I don't even know how to say, no, that's not the case. Now, having said that, right, my general approach is always the least toxic medication. For example, if I'm gonna go the benzo route when someone's on buprenorphine products, I will shoot for Klonopin, long acting, et cetera, Valium, and so forth. Now, again, as a practitioner, and this is what I was talking about, everyone's afraid of how the DEA looks at them and so forth. You got to justify it. Now, I might have somebody on Klonopin and 32 milligrams of Suboxone, and I know the patient well, and I've established a rapport, and they're having 2 anxiety attacks a month. Okay, they're going to get 5 Xanax at 0.25 to manage that. Okay, so in and of itself, being on 20 milligrams of Suboxone is not a contraindication for being on Xanax. Okay, it's how you manage it and how you manage all of it. And if the need arises, you want to have weekly prescription refills with. So, my point here is the answer is in some senses no, because those aren't a contraindication. Many people feel they are. But I've successfully managed many people like this. And in fact, I'll tell you one case I have right now. I have a young lady who's awesome. I love her. And she's been under my care for, I think, over a year. And in high school, she had overdosed on benzos. Okay. But she has severe PTSD. She has, IBS and all that stuff from this stuff. And I put her back on benzos, and I follow her weekly, and I started taking care of all the other symptoms, and we got her plugged into someone like Parham, and here we are a year and a half later, and she has made great strides. So, Zach, it's not a contraindication. I'm just concerned about things being appropriately managed. And then the most important thing is Parham. So I'll let him give you some feedback, because that's what's going to save you. How old are you?
24.
Tell me. Yeah. So you got a long ways to go, man. Right. So you got to stay healthy. And as far as I'm concerned, all medication have a potential for being toxic, and your goal should be no medications. Not that I'm aiming for that actively. You do a risk benefit. But for next 50 years, you got to get everything upstairs. Parham, please go ahead. Thank you.
Thank you,
Doc. Thank you, Doc. What's up, Zach? Yeah, I'm there. What's up, Zach?
How you doing?
Hey, I just I sensed your pain when you identified with Siglu about losing your home back in 2015 or 16. Was that when you said?
2000.
Was that 2000?
Yeah, correct.
Yeah, I sensed it when you identified there. I just I felt it. So I know that's some pain that you're holding on to. My condolences for that loss. I really mean that. That's a big life event. That's a big life event, man. I hope maybe you even connect with Siglu, because you guys might have some commonality to share about there, being on this show together. But I'll tell you this, that anytime someone tells me that they are in need of something to manage their anxiety, man, I'm telling you, I always go back to the same foundational thought process, right? So what is your history not with medications, what's your history, your personal relationship with anxiety? So tell me about little Zach. Was little Zach anxious?
Yes, definitely. When I was younger, I basically, I lived with my family for a little while. My mom was an alcoholic. So I had another, I consider them like my family. They're like my godfather, godmother, basically. They took me in when I was younger. They took care of me, gave me everything I wanted. But I didn't really have much friends when I was younger, and I was bullied in middle school and even high school. And I think that caused the anxiety and the depression and some form of PTSD that I experience now. But as far as benzodiazepines go, I don't take them like I'm abusing them. I mean, I just take them to manage my anxiety. It's not like when I take them, I'm slurring my words like what you do with alcohol, So basically, it's just I'm just using benzos illegally to manage my anxiety, and my doctor does not want me to, because he does not want to lose his license. And basically, it's not allowed, you know. So
I actually didn't assume you were. Yeah, I actually didn't assume you were taking your medication beyond what's based on the paperwork that you had of every medication dose you've ever taken in a very, very organized format. I knew that you're not using this stuff. So, but all that being said, when you talk about, you know, your childhood with your mom and her alcoholism, and you talk about being bullied, by the way, and I understand that, you know, I was a foreign kid, so I was bullied a lot too. I know the pain of that. But when you talk about being bullied and you talk about not having certain amount of, you know, social peers, connections, you know, healthy connections, all that kind of stuff like that, I'm telling you that you're using medication. Benzodiazepines helps you manage your anxiety. But let's just say, what if that stuff wasn't there, right? So let's just say that wasn't an option. How else can you manage that stuff? And what are you doing currently for your mental health? Like, are you seeing any providers? Are you doing any, you know, group therapy? So tell me what you're doing.
I go to my doctor weekly. So for the Suboxone, I go to my doctor weekly, and that also includes counseling, some form of counseling, whether it be a one-on-one session of counseling or a group therapy session.
Okay.
And that's basically required with the Suboxone MAT treatment. So basically, yeah, that's where I'm at. I don't get out of the house too much, but because of my depression, but you know, my grandmother needs help around the house. I still live with her. And, you know, when I need to like do something, I use her car because I can't drive mine. I don't have my license anymore. So it's just all these things are just kind of building up, you know, into this big pile of disasters, you know. So basically, I'm in debt. I can't drive my car, don't have my license, still living with family, and that's basically where I'm at in life. But, you know, I still have a long way to go. Like you guys said, I'm only 24, so I'm just kind of living it day by day, you know.
Yeah, man. And I'll tell you this, by the way, you know, being in debt, not having your driver's license, you know, not being where you want to be in life, you know, having a fear of the future, all that kind of stuff, that causes anxiety too. Not just in your case, in anyone's, in any human being's case. Like, these are life events and these are life stressors that produce anxiety, right? So if that's the case for everyone, not just your specific situation, it becomes even more. I'm really proud of you that you are engaging with psychosocial. You are going to groups. You are seeing clinicians, because it sounds like you have a lot of stuff to kind of be able to get off your chest and open up and process. And you got to keep doubling down and keep doing that. You know, you got to keep doing that, because maybe just going once a week isn't enough for you right now, giving all of the different stressors that you have. You know, maybe you need to go a couple times a week. Maybe you need to connect. You said you don't get outside the house. Maybe you need to connect with some type of a support group, whether it's online via Zoom, whether it's somewhere local, at least once a week, because the feeling of depression that you share, by the way, you told us that you're depressed. Depression and isolation, man, those two things go hand in hand. You know, it's really hard to not be depressed when you're also isolated. And, you know, taking care of your grandma, which is a really honorable thing to do, but that brings a lot of challenges on its own, because you're a caretaker. A caretaker sometimes doesn't have the support for themselves. Like, you take care of other people, but what about Zach? You know, that kind of stuff. So there's a lot of stuff here, man. There's a lot of work. And whatever, you know, when you go to the black market, make sure you're staying away from anything else illicit, because you don't want to add to more problems, you know, in your life. And that's the best.
That's another problem with benzos, is they can be pressed, you know, but I only get them from one person. So
may I add a couple of things, Parham?
Absolutely. I'm done. Yeah. Thanks for listening.
Zach, listen to me. Number one, as a physician, I also can't, almost slipped my mind. I also can't advocate you getting anything on the black market, especially benzo, especially with the way the crap is pressed nowadays and you don't know what you're getting. So I have to tell you, please stop that. It's dangerous and it's not good. You know, oftentimes what I do, my patients are very open with me. And if it's a serious thing, one option is he willing to, you know, and I put that in my notes. I'm very open about it. Our staff, and we make, you know, look, I do a risk benefit analysis. The guy's buying crap on the black market, I feel that in order to engage my client and patient and make sure that the long-term clinical outcome and sequelae are positive for a complex disorder, including polysubstances and extensive mental health, I need to keep him on his subs, and therefore I am going to add Klonopin 0.25 milligrams twice a day. I'm going to keep close tabs of him, have him coming every week, and reassess as I go. You got to have a clinical justification, and if you can speak it and justify it, it's okay. So that's one thing I want to tell you. Figure that out. So I'm not going to advocate, so the other thing I want to tell you, I'm going to play therapist here the way I do. I'm not a therapist. I'm not a psychiatrist. I'm not a psychologist. All right. Disclaimer. Here's the thing. All right. Let me ask you this. How much schooling do you have, and what kind of work, if any, have you ever been involved in?
I have my high school diploma. I went through the Conservation Corps here in California, finished the program there, worked for another company involving plants, and then I haven't really moved forward since.
What is your passion in life? Are you passionate about plants and nature and so forth?
Yeah, I want to be a firefighter.
Great. Okay. So I'm going to tell you something. What's that? Say that again.
Firefighter.
Okay. So I'm going to tell you something. All the crap you just told us, okay? I'm not minimizing it, because that is the almost the toilet bowl of everyday life that we suffer from. Here's what I am telling you, okay? All that stuff is heavy, and that's what bogs us all down. But I'm going to ask you to take a step back and expand time, okay, to next week, next year, 10 years from now, okay? And understand, try to look into, really meditate on this and understand none of these issues have to stay forever and get bigger and bigger. And most of them, we do find tools to overcome, right? And you can too. Do not think it's the end of the world, the license, the debt, the fire, okay? It's an opportunity. Shitty things that get thrown at you, you want to know what they are? A challenge and a chance to improve myself, okay? At 50,
to make you stronger.
Well, to not only make you stronger, but to make you mature and grow. That's fundamental for me. And I still do some of this stuff every morning that I wake up that I was working on when I was 19 years old, and I'm still at it. And you know why? Because I wake up. Until I stroke out of my sleep, I won't do it. And then I'll say, okay, I didn't get there. So in your case, you're 24, okay? Get the medication straight. It can be done. Take care of your finances. It can be done, even though you're like, this guy doesn't know what he's saying. You don't have a license right now. You can have one in a year. Take a moment. Meditate on this. Seek the right mental health. Solve. But here's the thing. Don't do knee-jerk reactions to crap that will get you more trouble. Solve this street Xanax crap, all right? And that's my parting words. If you're down here, come see me.
Great. Thank you, Dr. B.
Okay.
Thank you, Parham.
You got it, buddy.
You guys.
Yeah.
Take care.
Bye-bye. Great kid.
What a good kid, man. He's a good guy.
I would love to actually see this kid because it just seems one of those cases I really enjoy. But it's so many of them are so awesome. Okay, what now, Parham? We're getting to that. We got to figure this out where we can.
We got about 20 minutes, just so you know, so it's not too time pressed.
Let's see. If you can't get benzos, you can.
There's so many. I mean, we're so far behind on the chat on this side. I haven't even paying attention to it.
Okay. Yeah, it's so hard. Jillian's my buddy. I think she's from Scotland. I always see Jillian. She's pretty cool. Okay. Get a couple of them here. Hi, Misty. Okay, TikTok, we are winding down to the last, I think, 15 minutes, 20 minutes. If you have questions, get on the channel. By the way, those of you that are new, please, if you like this, I guess if there's a like, press like and subscribe to our channel. We love the additional followers. Oh, God, there's so much.
There's so much, I know. And there was one thing this guy said here. He just said, if you guys haven't been addicted to something, there really is no way you can know where the addict is coming from. Not to say these guys aren't being helpful. So I'll tell you this. I know Dr. B, I can speak for him, is his whole entire life's work has been dedicated to the fact that his father overdosed and died when he was 4 to 5 years old. So addiction is something very personal. And for me, I'm actually 13 years removed from snorting any drugs or drinking anything or shooting anything or smoking anything. So Danny, I want you to know that this is not just a bunch of professionals sitting here talking about addiction as if it's removed from us. Addiction is very, very near and dear to our heart, bud.
Yeah, and Danny, a lot of people on a lot of channels think I'm an addict or an addict in recovery or whatever. I never respond to the question why I have kind of an insight. But I can say this globally, as Parham said, my whole existence has always been, let me just say this, the mindset of an addict. And I come from addiction in so many different ways that, my father passing away is just sort of a tip of the iceberg. And so I hope that helps. Hi, Misty. Sherry. A lot of benzo stuff here.
Yeah, I know.
And it's one of my Missy, you should come on and say hi to us if no one's. Oh, there's Misty. Yeah. Wow, she was on here. I was going to say Misty should come on, and I always see her. Hi, Misty. How are you?
Hi, I'm doing well. Thank you.
What's up, Missy? Thank you for coming on.
Thank you. Yeah, I am one of Dr. B's patients. And I can't say enough about him. He truly saved my life. I've been on, I was addicted to pain medicine for 18 years. And at first, it was very easy because I have multiple sclerosis. So they would just give me until I couldn't get them anymore. They had where you would fill them and then every pharmacy would know. And then, I used other drugs as well. I used methamphetamines, Xanax, my benzos, and I had numerous overdoses. I tried the NA way, kept relapsing. I could not get clean. And my last overdose, I came home from the hospital, and on TV, there was a commercial about Matt. And I wrote the number down and called it, and that's where I found Dr. B. And I went to go see him, and that's all she wrote. I have been clean almost 2 years now, and I'm just so grateful for you, Dr. B. You have done such amazing things for me. I'm currently in your IOP, which has turned my life around, done amazing things, and I just can't say enough good things about you. You're a caring doctor, you're a non-judgmental doctor, and we need more doctors like you out there, Dr. B.
Thanks so much for the kind words, Missy. But let me turn it around on you, and I won't to say too much. So Misty is pretty amazing. And again, Misty's I won't go into details. What is one of these? And just so you guys know, I don't get to see Misty so much anymore, but I keep track of her every month because my awesome PA. Alexis takes care of Misty and tells me about her. But Misty is one of those that it was a complex case, and there's a lot of stuff going on in the background. And we just chopped it up as we needed to for Misty, which is, you know what, Misty? I'm going to see you every week, and you're only going to get this much medication. And we've recruited mom into care. And so, you know, from the practitioner side, and she's been a joy, and she's awesome, and we love seeing her kick ass. And the office talks about her all the time, how she's kicking ass. But it's about you know, carving the care to what she needs with the resources that we have. And Misty, I appreciate all the kind words. I swear, everybody, she was not paid to come on, but she is doing amazing. And Parham, I don't know if you have any feedback for her, but she's kicking ass, and I'm really proud of her. We talk about her quite often in our little clinical weekly meetings.
Yeah, no, I don't have anything specific except, hey, Misty, thank you for coming on.
Thank you so much.
And your genuine kind of feedback and remarks regarding your history with you know, your background and how Dr. B's helped you. I knew it wasn't. You can tell when something's genuine and when something isn't. This was definitely it seems sincere, and I know the reason why you were compelled to come say a few good things about Dr. B is because I believe that whenever we're able to experience like authenticity and caring and someone that actually individualizes care, it makes it really easy to come give a review about that product or service. You know, it's just that's the whole point of it. Yeah. So the fact that I know that whatever happened inside those rooms and inside your care has been something that's led you to this moment to come up here and be compelled to say something. It's the byproduct of really good clinical care and love. So thank you, Misty. I appreciate you.
And let's give Misty, Misty, you know, no matter what, I could be the greatest neurosurgeon, but if you don't show up, I can't do anything. True. Let's absolutely categorically give you your accolades for this, right? Again, I could be the greatest heart surgeon. You don't show up, I can't do the bypass. And so showing up in substance abuse treatment is 90% of it as far as I'm concerned. And you have, and I know all of your issues, and you have been courageous and brave, and you have put your money where your mouth was, and we are all blown away by you, and thank you.
There's one thing too I want to add there real quick. The teacher appears when the student's ready. So Misty, I don't know, there might have been a time in your life that you would have sat in front of a Dr. B and he would have been sitting the same way, saying the same stuff, and he would have gone in one ear and out the other. And, you know, it takes what it takes sometimes, that when we meet the right person at the right time, we hear what we need to hear, and then we do what we need to do. So I do believe that there's stages of readiness. And thankfully, in your case, when you met Dr. B and came a part of his program, you were ready for what you were about to receive.
Yes, I agree.
Right on.
Thank you guys so much.
See you soon. Say hi to your mom.
All right. I will. Thank you. Bye-bye.
Bye. Parham, you pick. I'm too old. I can't see all this, and I have ADD.
There's so much. I mean, when people pop up, it's easier. That way we don't have to go through all of the side chats. If someone just pops up, and that was the beauty of today. I think it's been one person after another.
Yeah, you guys got to start popping in, man. We'll answer as much as we can. If you got to pop in enough where Parham and I have to put a 5-minute limit on this and become experts at pushing you through the door. Because we're going on here and we're trying to, and some of you can just pop in and say hello and whatever. I see a lot of cool people on here. Jillian, I've been I see her all the time. I think she's over in Scotland, if I recall correctly, but there's all kinds of neat people on here. Same with you guys on TikTok.
There's just random comments. So I'm not saying which one you have to pull up, but there's people asking if if you would be able to see them in different states. I'm pretty sure the telehealth laws are you have to be in the state that you practice, correct?
Yeah, guys. Unfortunately, yeah, I can't see you. I can see you in this state nowadays. It's pretty lax. Telehealth. There's people that make a trip out. Some once a month, some every 3 or 4 months, depending on the severity of illness. Right. I won't take anything and everything on in that way. And even people in state. If you're an active addiction, and I can't, and from telehealth, I can't. Make the judgment that, you know what, we're on good track and you can give me a urine. Even in state, I make you come in. Out of state, same thing. I'd love to see everyone everywhere, but we can not realistically. Sometimes I do international or out of state coaching, kind of without any medication or medical stuff. But yeah, I can't take patients from out of state. Scotland, yeah. Jillian's from Scotland. Let me see if there's anything on TikTok. While you look at that, I'll look at the TikTok comment.
Okay.
Thank you, guys. Thank you, Kitrin.
Yeah, if anyone's watching this, just got on. We're on live every single Sunday at 1:45 p.m. Pacific Standard Time. So do a Google search and find out what that is in your time zone, since everyone's from all over. And the link that keeps getting shared by Nicole is something that when you click on, you can actually come in and join the broadcast. And you've seen some people come on with their videos, and some people have come off with just their audio. We prefer to see your face, but if we don't, it's absolutely okay. If you have any specific questions you want to ask, both of us here, Dr. B will cover the medical component and his expertise, and I'll do my best to cover the clinical component in terms of mental health. So you have two people committed to answering your question.
Yeah, and some people on TikTok are asking where we're at and so forth. Guys, we are in Southern California. We're in Orange County. And like Parham just said, for you TikTok guys, we are on here every Sunday. We always start off with some interesting topic that you guys may want to hear about. We have a brief discussion, but this whole platform is for you guys. So if you go on there, it's super cool and super easy. Like Parham said, you can just pop on. We can answer the question. You can show your face. You don't have to show your face. And this is purely educational for you guys. And every Sunday, 1:45, right, Parham?
1:45 p.m. Pacific Standard Time.
Yeah. And we would, we'd love to see you. If you like the content, please go ahead and subscribe to that channel. But other than that, we just want to see you guys. And I think we're getting, what is the link? I don't know. It's my channel. It's, my channel is, shoot. What's
Dr. B Addiction Recovery on YouTube.
Yeah, Dr. B Addiction Recovery on YouTube. All this stuff is in the, it's very easy to find. I am not a genius at this stuff. So these guys know it. Parham, you see anything? I know there's a bunch of thoughts and stuff, and people, they're getting more and more comfortable with getting on.
I saw Alex from Serbia. I remember she came on a bunch of weeks ago. She came on and just said she found us really trustworthy, wanted to say hi to us. So that was one of the most interesting calls we had.
Did she come back today?
It was just a comment on the side.
Oh, yeah. I wish I would have seen her. She's doing okay, I hope.
Yeah, I think so. Yeah, it sounds like it. The tone of voice seems positive.
Good. There's Pascal. God, I got to get better at this stuff. All right. How do I kick heroin? How do I answer that, Wildflower? Utah. Oh, here's a drug and alcohol counselor. You should come up with some material. I love your content. Thank you. Come on the show. It's me and Parham, and he runs a big facility, and he's I guess he works with a lot of you guys, and come on and ask Parham some stuff. MAT saves lives. Yes, it does, Kidwin. Okay, I think we're getting there, Parham.
Yeah, I'm good, man. If anyone's popping up, we're ready. There's too many questions on the side.
There is, and on here too, guys. Stop asking me this stuff. So I'm not going to cogentin. That's a great discussion. I can't do it, guys. Parham, hey guys, thank you on the TikTok. Parham, guys, all of you, we really love the fact that you came on. Please make it every Sunday. Tell everybody about it. It's free. And you have two professionals, and we do the best to give you feedback and answer the questions. And those of you that know us, we know what we know what we don't know, and we tell you when we don't know it, and it's inappropriate. I think on this channel, you will get the most authentic response than anywhere. And what do I mean by that authentic response? Number one, Parham, I spent a year figuring out who I should have on here with me because of my own mental health issues. I don't trust or value too many people's judgment on things. Okay, so I have some control issues and trust issues. Number two, he has a moral compass like nobody's business. And so that being said, you're going to get authentic response. There's not much that, if we don't know, we don't know. And we'll be really honest with you. And it's free, guys. We got one more person on here, Melissa Ramirez. I would hate to leave her without answering. Can we do it, sir?
Bring her in. Yeah. And thank you for those kind words. The feeling is definitely mutual.
Thank you, Parham. Here's Melissa. Hi, Melissa.
Hi, Dr. B. Thanks for
What's
having
up,
me
Melissa?
on.
How are you?
I'm doing good. I kind of have like a complex little issue. I've been a legitimate chronic pain patient for 12 years. I'm a domestic abuse survivor, so my neck was snapped in a couple of places. So I've had multiple surgeries on my neck, in my spine. So anyways, fast forward to that, I'm treated okay with psychiatry medication, also depression. Sorry, I get a little bit nervous. Depression medication, and also opioids. The thing is with the opioids is I have a ultra rapid metabolization. So in certain medications, they metabolize very quickly. So how do I like approach a provider to help me with those things, with medicines, or let alone to get off of the medication that I've been on for so long? But I have records after records after records after records to prove those things to providers and show them, and it's just been very hard for me. It's been a very hard road, so I just trying to get some input from other places, I guess.
Let me see if I can give you some brief distilled feedback. Is the question, do you have a provider right now?
So I do not have a provider that treats me according to what I need. I have a provider that I see over the phone, so to speak, for medicine, but I have already given them all the documents for like, my ultra rapid metabolization, what pharmaceuticals work best for me, what pharmaceuticals don't work best for me, and the provider keeps providing the same medication. My psychiatrist, on the other hand, does work in an addiction clinic, which I gave her those documentations, and she treats me accordingly with the medications that work better with my system. So yes and no.
Yeah, I mean, I'm trying to figure out what it is you're specifically looking for in the provider, whether it's a certain brand or type of medication that you want. Is it you want one provider to manage all of these things? You gotta help me out. And sometimes I'll be really frank and honest with you. Sometimes I listen to everything the patient has to say, and and I look at all the documents, for example, this rapid metabolizing issues and so forth, those tests they run, many of those tests are not what's called specific and sensitive enough in terms of their accuracy. And for the most part, sometimes I don't pay necessarily attention to them. So depending on what you're asking, yeah, this is a good answer. Depending on what you're asking, you may be getting some resistance. Not always. They need to listen to you. I have a guy from Ohio that I treat, and he comes out here every couple of months. Sort of the same issue, right? And I looked at everything, and I decided that what he was describing is the best way to go, with very close monitoring of him. And we're doing that, and it's working out, and he comes out every couple of months. So if you're asking for a central hub provider and they are resistant to putting you on all the medications, I don't know those medications, but it could be, if you're asking for Roxy's 30 milligrams 3 times a day. No, I know you're not, but if it's not something like that, I'm hoping. Where do you live?
I live in Arizona, but I definitely can make the trip out to see you. Flying is not. I'm capable of coming to see you. Basically, I have the funds to do that if I could see you.
Yeah, if you're interested, talk to Nicole.
Okay.
And because I don't know enough about all the stuff you're saying, but I'm giving you reasons why providers might be resistant, and sometimes they're just resistant for I have no idea why. Again, I approach every situation as first education, then seeing where you are at, seeing where I'm at, and us coming together and coming up with a short-term and long-term plan. That's the best answer I can give without giving medical advice. So talk to Nicole. She can lead you down a better path of all this. And I'm so sorry about being the domestic abuse survivor. That's crap. Yeah. Are you getting any help for that? Parham probably wants to know.
So I see a psychiatrist, but basically she just asks me what meds work best for me, and then just kind of sends me on my way. I don't have any therapy. I don't have any anything really. I mean, I definitely need to have therapy because when I'm in chronic pain, it sets me. It brings back my traumas because that's where it originated from. Is from the trauma. So anytime my pain is undertreated or not being treated appropriately, other things come up in my brain, and I start getting panic attacks, and then PTSD comes in and all that kind of stuff. So just a lot of different things. I feel like I'm a really complex case, and I feel like sometimes when I see providers that they just really don't want to have the time to listen to me or listen to what I have to say. It's either one way or the highway. So it's just been very frustrating to say the least. And I just moved to a new state, which is Arizona. I moved from Washington, where I was receiving actually pretty good care there. I had a really good psychiatrist and a good regular doctor. But of course, when you move, they really don't want. They can't treat you in other states, basically. I would have to fly back to Washington multiple times or fly back. And so it just, it gets kind of hard sometimes. So I think it's just in the overall things of like moving and trying to find new providers and listening and doctors that don't know me very well. I think it's a lot of it too. So just hard.
I get a better sense now. By the way, I can say this because I'm a medical doctor. Psychiatrists, who are my colleagues as medical doctors, we are not therapists. Psychiatrists are, some of them are, they get advanced degrees, but if I was a psychiatrist, we're essentially a very, very advanced neuropharmacologist. I'm saying this kind of jokingly because, we can't do the kind of stuff Parham does or the other guys do, Look, it sounds like actually a great case, and you seem like a very, very sweet lady as well. Give Nicole a call. And okay. I don't know if Parham has any feedback, but give Nicole a call, and thank you for sharing and coming on.
Thank you for having me. I appreciate it.
Okay. My feedback's just short. It's thank you for having the courage to share about that domestic violence, abuse. There's people, I promise you, on the side chat that meant a lot to them, because they might not have the courage or even the ability to say that out loud to themselves, let alone on a live stream. But there is a lot of PTSD, post-traumatic stress disorder, that comes from situations like that, especially because of the severity of it. And it sounds like, you know, the fractures, and that's not a one-time thing. I know that's just not the only time something like that happened. You know, that's usually the end of a previous journey and road with that same person that was probably just as rocky. And I don't know what the history.
Multiple times, yes. So that was the last time that.
I know. I didn't want to say it that way, but I was under that assumption. And usually it's like, hey, what, even before that relationship, was there any, you know, codependency going on in your world? Was there any type of, you know, putting yourself second and putting other people first? I mean, this stuff becomes where the magic of therapy happens, is because when you see the end result, which is a hospitalization, fracture, that's only the end of a road that was already traveled. And when you go back in that road and find out patterns and find out, you know, ways that you adapted to dysfunction in your life, and how is that hurting you, or how is it helping you in the future, that becomes the roadmap for healing and recovery. There's a lot of somatic therapists, because there is a theory that they believe that trauma is stored in the body. You know, The Body Keeps Score is the name of a good book that you could probably check out, and look into those traumatic forms of therapeutic modalities that deal with trauma. So when you look, there's going to be somatic therapy. You'll come across something called EMDR. You'll come across something called brain spotting in your local area. Maybe just do a little research, find out, you know, do research on the actual clinician, find out about their history, if they've ever worked with situations that are as complex as yours. And believe it or not, I know yours is complex, but there's a lot of complex situations out there too, and people can get help for those levels of complexity if you just find the right provider. So do your little research, find a clinical, you know, human being that can help you with the psychopharmacology piece that you're utilizing the support of the Dr. B's of the world to get that piece. Because Dr. B will tell you, maybe some psychiatrists won't say that. They just say, hey, take the medication, you're going to be good. Dr. B will tell you that's only one piece of a much, much, much greater puzzle. You have to get that piece right. Yeah. So you have great presence. You speak well. You carry yourself well. You seem like you have a lot of, you know, in terms of like just confidence right now in this moment. So use this momentum you have, use this energy you have to be able to add those pieces that you need for your healing journey.
Okay. Thank you. I appreciate that. Thank you for having me on.
Bye, Melissa. Reach out. He's right about all of that stuff, and I agree 100%. So hopefully we'll see you again.
Yes. Thank you. Have a good day.
Bye-bye. Hey, guys. Bye. Hey, this was awesome. I want to also point something out. Parham, what is your channel on YouTube again? I mean,
you know, to be honest, my Instagram's my most common one. It's just the 1 Minute Therapist. Go to Instagram, check it out.
1 Minute Therapist.
1 Minute Therapist. That's where I'm the most active.
Yeah. So go to subscribe.
I'm here with you, Dr. B. I'm here with you. Well, you can find me wherever Dr. B is on these Sundays.
Yeah. So, but again, this is awesome, guys. Get your butts on the channel. Ask the questions like I was bragging about us. This is the most authentic response you'll get, and it's free. Enjoy it and utilize it. Okay, we are going to go. We're well over 2 hours. Every Sunday, 1:45 p.m., YouTube channel, Dr. B Addiction Recovery, me and Parham Namatola on the 1 Minute Therapist. And that's it, Parham. Any parting words for this, guys?
No, that's all, man. I promise we'll be here next week, same time, same place. I love this. Send us messages, write us comments on our videos. We'll go in and respond to you guys. And looking forward to being with you again next week, Dr. B.
Okay, Parham, John. Let me say bye. Okay. So should I end broadcast? Is that what I do?
Yeah.
Bye, guys. Thanks for coming. Get your butts on here and ask some questions. Let me end the broadcast.